Good morning, everyone, and welcome to all of our participants from across the U.S. I'd like to thank you for taking the time out of your day to join us for the Population Health Collaborative webinar series. My name is Karen Hall, and I'm the Program Manager at Population Health Collaborative. If this is your first exposure to PHC, we are a regional health collaborative that brings together diverse stakeholders to improve the health of Western New York. And the program you'll be hearing about today is a perfect example of a population health program that gets results. I am so thrilled that our friends from the Heart Smart for Life program agreed to present to you all today. So just a quick reminder before we get started, your lines will be muted, and if you have any questions, you can type them into the chat box at the end of the presentation, and we will feed those to the presenters from Heart Smart for Life. The webinar will be available for viewing about 24 hours after this live presentation, and you all will be receiving an evaluation that we would greatly appreciate it if you would complete that, please. So the Western New Yorkers are now able to get Heart Smart for Life thanks to generous grants from the AstraZeneca Healthcare Foundation to combat heart disease in one of Buffalo's poorest neighborhoods. The Mercy Foundation is one of only 10 nonprofit organizations across the country to receive this funding as part of AstraZeneca's Connections for Cardiovascular Health program. The Heart Smart for Life program is based out of Mercy Comprehensive Care Center, located on Louisiana Street in what we call here in Buffalo the Old First Ward. It is a collaborative initiative aimed at ensuring vulnerable populations, those who otherwise might fall through the cracks, have access to nutrition education, free health screenings, wellness programs, and other resources focused on preventing heart disease. The program offers participants educational sessions on healthy eating, exercise, and much, much more. The program is free and open to the community, and participants do not need to be current Mercy Hospital or Catholic Health patients. So on that note, I'm going to turn it over to Kathy Swenson, the Executive Director for the Mercy Hospital Foundation, who will kick off the presentation this morning. Thank you, Kathy.
Thank you, Karen, and hello, friends. Thanks for joining us for today's webinar featuring the Heart Smart for Life program. As Karen mentioned, I'm Kathy Swenson. I am the Executive Director of the Mercy Hospital Foundation, and I am so pleased to start our presentation today by introducing Dr. James Blissetto, Board Chairman and Trustee at the AstraZeneca Healthcare Foundation. In addition to his volunteer role with the Foundation, Dr. Blissetto is a cardiologist and the Vice President, U.S. Medical Affairs, Evidence Generation at AstraZeneca. He's also a fellow in the American College of Cardiology and a past president of the American Heart Association Delaware affiliate. Dr. Blissetto is going to speak to us today about the AstraZeneca Healthcare Foundation's Connections for Cardiovascular Health program, which has provided grants to Mercy Hospital Foundation for the past couple of years. Dr. Blissetto?
Good morning, everyone. Thank you, Kathy. Before I get started, let me first thank the folks from the Population Health Collaborative and the team from Mercy Hospital Foundation for the opportunity to join you at this webinar today. I'm here joined by my colleagues, Joyce Jacobson, who's the Executive Director of the AstraZeneca Healthcare Foundation, and Colleen O'Brien, Program Manager. Before I get started, I'd like to just set the stage. As a cardiologist, the American Heart Association has reported that cardiovascular disease afflicts more than 92 million adults in the United States, and despite some great advances that we've had in cardiovascular treatments and therapies, it still represents a leading cause of death. This number represents a real human and economic cost to our nations, our community, and our families, a cost that we can no longer afford to bear, both emotionally and financially. Now, the AstraZeneca Healthcare Foundation is a tax-exempt entity under the Section 501c of the IRS and separate from AstraZeneca. In 2010, we created and launched the Connections for Cardiovascular Health program with a $25 million contribution from AstraZeneca. And our mission was was simple but important to improve cardiovascular health in the United States. Since we began the program, the Foundation has received thousands of worthy applications from various organizations such as clinics, hospitals, civic organizations, universities, and we've now awarded nearly $25 million in funding to support 49 organizations, as is shown on the map, which represents the best of the best. I'm proud to share that and when we look at what we've accomplished thus far, we've collectively reached over 1.6 million lives through the activities such as health fairs, screenings, education materials, workshops, and we've now tracked over 58,000 participants for the progress and improvement in their cardiovascular health measures, and including 54,000 unique participants in the grants over the years. In addition, the Foundation is committed to sharing lessons learned from both the Foundation and our grant awardees to help interested organizations learn from these efforts. This brings us to the reason why we're here today, which is to highlight the exceptional work of Mercy Hospital Foundation and their Heart Smart for Life program, and to hear about their lessons learned. Now, the Mercy Hospital Foundation has shown promising results from their Heart Smart Life program, has helped over 150 participants to reduce their cardiovascular risk factors, as is demonstrated by improvements in clinical and behavioral measures such as weight, blood pressure, physical activity, and knowledge of cardiovascular disease. Mercy Hospital Foundation truly embodies the spirit of the Connections for Cardiovascular Health program. They have worked to overcome challenges, to launch a new program, demonstrate positive impact, and are now sharing lessons learned so that other organizations may benefit from their learnings. We are truly proud of the work that they have done to improve the heart health in Buffalo, New York. So without further ado, I'd like to turn it back to Kathy Swenson at Mercy Hospital Foundation to tell you more about the Heart Healthy program that they have. Thank you.
Thank you so much, Dr. Blissetto, for joining us today and for your kind words and support. We are truly grateful. And I'd also like to thank Population Health Collaborative for inviting us to connect with you and share lessons learned from our Heart Smart for Life program today. To begin, let me tell you a little bit more about how the program began. In 2013, our wellness initiative, then called Empowering Buffalo, started as a grassroots effort to literally feed the need of the patients and families turning to the Mercy Comprehensive Care Center, or as we like to call it, the MCCC, for primary care. Our care providers recognized that many of the children and families coming to see our doctors were either undernourished or lacked nutrition education. The Mercy Comprehensive Care Center serves 12,000 patients and provides 39,000 patients visits annually. Almost 50% of the people living in the 14204 zip code of Buffalo, New York, where our center is located, are living in poverty. The nearest grocery store is over 2 miles away, so this section of the city of Buffalo is a food desert. Our patients and families shop for food at the corner store and the local gas station. In 2016, generous funding secured by the Mercy Hospital Foundation from the AstraZeneca Healthcare Foundation enabled us to transform Empowering Buffalo into a measurable and impactful program that is Heart Smart for Life. I'd like to share a video with you today featuring our first champion, Nicole Arquette, and her health journey.
Mercy Flight 9, Mercy Flight 8 and 5. Having stroke-like symptoms.
Instantly you think death. You really think you're going to die first. Nicole Arquette knows what it's like to have a stroke.
Mercy here, this is Dr. Cosgrove.
We're going to be bringing you to the hospital.
Okay, very good. What are the symptoms, please?
I was telling Larry to tell my son goodbye, my daughter goodbye.
Okay, very good. We'll see you when you're here.
Left side weakness, started about half hour ago.
Okay, my name's Jenna, I'm the nurse, and we're going to take you right back, okay? Hi. What's your name? Nicole. Nicole. Hi, Nicole. We're just going to get you into the bed, okay?
In fact, she knows what it's like to have 2 life-threatening strokes just months apart. The second one was the harsh one.
All right, Nicole. We're going to take you to CAT scan right now, okay?
It sounded like people were talking backwards.
All right, we're going to take over to CAT scan now.
I kept thinking, they're not going to know I want to live. While recovering in the hospital, Nicole received information about the Heart Smart for Life program at the Mercy Comprehensive Care Center.
I used to call myself a stroke victim. Now I'm definitely a stroke survivor in every aspect of the way. And Heart Smart, a lot of people at Heart Smart are the ones that did that for me.
Once we get them in there, they generally look back.
100% whole wheat toast and a big spoon of peanut butter.
Heart Smart for Life is a comprehensive wellness program that combines measurable data with positive behavioral and social support to encourage proactive change.
It does touch upon all the different areas that it has, from nutrition to tobacco to healthy recipes to eating to exercise.
The classes build community, camaraderie, and connection in a non-judgmental environment.
You really get a variety of support mechanisms.
Baseline measurements for body mass index, cholesterol and lipids, blood pressure, weight, and when applicable, glucose and hemoglobin A1C are collected when a patient enters the program. Patients' measurements are reevaluated at the end of each 3-month session. Additionally, surveys are conducted to measure cardiovascular disease knowledge, nutrition habits, exercise levels, and overall mood and patient satisfaction. Referring physicians receive regular reports on patient progress.
Teaches you beyond what the doctor's telling you.
A year after the strokes, Nicole has lost over 60 pounds. She's turned her life around and was honored as the first Heart Smart for Life champion.
God bless them. God bless them, and thank God they're here.
Heart Smart for Life is open to all.
They can come from any community position. We would encourage it. Certainly, we would love to see our numbers grow.
I just don't know what I would have done without them.
Has it changed your life?
It has definitely changed my life.
Funding for Heart Smart for Life was provided to Mercy Hospital Foundation Incorporated by the AstraZeneca Healthcare Foundation. If your patients could benefit from Heart Smart for Life, call 716-923-6152 today.
Since January 2017, Heart Smart for Life has reached 1,400 people and is actively tracking the progress of 240 participants. In year 1 of the wellness program, we've actively engaged 158 tracked participants who collectively lost over 380 pounds. 90% increased their physical activity level. 46% began exercising for the very first time. 85% now say they understand how to identify the signs of a heart attack or stroke. 87% are eating fresh fruits and vegetables every day, and 100% of the participants have a blood pressure in the range of 140/90. So far in year 2, which kicked off in August 2017, with our second round of grant funding, we've reached over 700 people and are tracking 83 engaged participants. Together, they've lost about 97 pounds. 94% of the participants with an active diagnosis of hypertension have reduced their blood pressure, and 100% say their self-esteem has improved. Now it's my pleasure to introduce Jeannie O'Hara, Heart Smart for Life Director and Mercy Comprehensive Care Center Manager. She's going to talk to us a little bit more today about the key lessons learned and the program structure, our tips, our tools, and some of the tactics for recruitment and retention. Jeannie?
Good morning, everybody. I'd like to welcome you on behalf of Mercy Comprehensive Care and our Heart Smart for Life program. I'd like to refer to myself and the other people on our team that are going to speak after me as our boots on the ground. We are the people that actually engage the patients and get the program going. Our program goals are simple. We like to try to reach out to the most vulnerable, the high-risk patients, and improve their physical activity, their healthy eating, their knowledge of cardiovascular disease, and give them the tools to take care of their own health. Educational programs that we put on for the high risk, we hope that will improve their clinical measures such as blood pressures, body mass index, and cholesterol levels. Our recruitment is really based out of the community, and it is focused on our community events, adult wellness visits at our Mercy Comprehensive Care. We like to say that anytime someone walks into the clinic as a patient, they're automatically a patient of HeartSmart for Life. They have the right to choose whether they participate in the classes, but the care is the same. We try to provide quality care for our high-risk patients. Our partnership with the hospital has really opened up the doors of our clinic to include not only cardiovascular disease, which the program started with, but now we've incorporated stroke prevention and our diabetic education, and we've even started a small exercise program that you'll hear about later. All the patients, I have a one-on-one nutritional counseling session. Baseline measures are taken. Vitals are taken at the beginning of each class. Stress levels and self-esteem are monitored for improvement, and our pharmacist engages them by teaching them and counseling them on their medications. All participants are encouraged to attend 2 classes a month. It's only a little bit of time to take care of your health. If needed, if someone walks in our doors from the community and doesn't have a primary care physician, we make sure that they have one when they walk out. On our tips and tools, it's really all the small steps that matter. We've created a judgment-free zone. We have made it fun and made it work. We've broken through the walls of our clinic, much like the Sisters of Mercy did in the past. Our clinic is actually built on the land where the Sisters of Mercy convent stood. And I think that spirit engages all of us and truly speaks to the mission of Catholic Health. For recruitment and retention, we've done so many things. Myself and the team have gone to endless health fairs at elementary schools and high schools. We've enjoyed every bit of it. Believe me, we've had a lot of fun. Neighborhood festivals, church events. We've reached out to our community center in the area, which is called the Valley Community Center. Recently, Catholic Health even participated in the probably one of the biggest events in the Valley, which was our St. Patrick's Day parade in the Old First Ward, and we had quite a presence there. And it was really funny because to see people, as we were walking down the streets with our float, people saying, "Oh, Mercy, thank you. Oh, I was born at Mercy. Oh, I see your doctor at Mercy." So that was kind of really, really fun and almost eye-opening. I didn't realize that the people would be welcoming us so much. Outreach to high risk, we make sure our providers are identifying high risk in our clinics. Our clinic actually holds the residency program for Mercy Hospital, and one of our residents stopped in yesterday at the program and said, "What's going on? What is this?" And when I explained to him, he just couldn't believe that we were actually offering this service for our patients. We've actually gone to one of our biggest events is Buffalo Homeless Connects, and that is a program that is actually buses our homeless from the area in for health services, and Catholic Health is a big part of that, along with Mercy Hospital. Our Mission on the Move program is actually we are able to give free blood work to people and reach out to them and make sure they are aware of the HeartSmart classes. Many of our patients that participate in the program have voiced an opinion that, well, the gift card got me in the door, but now that you got me, I love this program. It really has made us more aware of what is educational, and we're reaching out and really asking them, what do you want to hear about? How do you want to What do you want us to talk about the next time? We've empowered participants to create their own SMART goals, and I know you'll hear that over and over with this. We meet people in their community, find out what they need, and make sure that they're taken care of. Mercy Comprehensive Care is much more than an ordinary doctor's office. It truly is a way of life and where we create our mission and our goals together to help the community. Our lessons learned are start small. I can't tell you how many months we tabled in our lobby, making fresh food and sampling with our neighbors and our patients. We found out and talked to people and found out what they were looking for and developed a program around it. Our lesson learned especially is that progress takes time. We have to keep an open mind and make sure we're reaching out and definitely getting something for the patients. We've gotten creative. We offer incentives that we are very thankful for. And most of all, the high-risk population is hard to serve. They sometimes don't have a basic understanding of the program or where to even start to take care of their health, and I think that this is a huge start for them. Our non-judgmental zone is key to our progress and our success. I want to thank you for being able to share with you today.
All right, thank you, Jeannie. And just a reminder, everybody, this program is free and it's open to the public, and it's been really exciting to see how well and embraced it is for everybody. Now it's my pleasure to introduce Anne-Marie Smakowski, HeartSmart for Life dietitian, to tell you more about our nutrition education program and how we are effectively measuring success. Anne-Marie?
Good morning, everyone. It's a pleasure to be here today. So we will first begin with reviewing nutrition education as part of the HeartSmart for Life program. So remember, food is fuel for the body, and nutrition education is a real key component to healthy living. As we are all well aware, poor nutrition is a contributing factor to many chronic diseases such as obesity, type 2 diabetes, cardiovascular disease, as well as depression and anxiety. The HeartSmart program addresses this issue by featuring group nutrition classes, one-on-one nutrition counseling, where the participants receive an individualized meal plan and a nutrition assessment is completed by the dietitian. And we just started several months ago a monthly diabetes education classes by the registered dietitian and diabetes educator. On the initial visit, each participant receives a food and activity journal. It is a useful tool to enhance mindfulness. And there have been many studies that have shown that people who journal their daily dietary intake lose 50% more weight than those people who don't. So the food journal monitors what, when, and how much food they consume on a daily basis. We find that so many people underestimate how many calories they consume on a daily basis, so this is a great wake-up call. The journal also tracks the participants' healthy goals such as nutrition and exercise. We also provide a water bottle that serves as a reminder to drink more water, as opposed to those sweetened beverages such as soda pop, Kool-Aid, and the like. And also, we provide a pedometer, which increases awareness of their daily activity. Many of our patients are very debilitated, so we start small. We don't look to that 10,000 daily steps right off the bat. It takes time to really get to that point. Initially, when the HeartSmart for Life curriculum was in development, we focused on the common barriers to wellness, especially those that involve healthy eating. And the first barrier that you see is literacy, and our participants have a broad range of educational levels. In our classroom, we have the college educated to the learning disabled. So our teaching strategy is presenting in a straightforward, simple manner using visuals such as food models, appropriate size plate bowls, glassware examples, cooking demos to enhance that visual experience. Then there's the lack of nutrition knowledge. Many of our participants have commented how overwhelmed they are by the media when it covers certain nutrition topics, such as those countless number of fad diets found on the internet. And they have a problem deciphering nutrition facts from fiction, and that's where we come in to clarify that. Many of our patients do not know their numbers, meaning they are confused about the different labs, such as a lipid profile. They don't know the appropriate ranges for HDL, LDL, triglycerides, or for the diabetics, the A1C range, what's appropriate. And that's, again, we try to help provide them with that information. So labs are reviewed during the course of this 3-month program to help them understand all these factors. Cost is another example of a barrier, and due to the poor socioeconomic population we serve, the nutrition presentations regarding meal planning, grocery shopping, or cooking demonstrations must be budget-friendly. Recipes must be healthy, easy to prepare, and the number of ingredients kept to a minimum. Location and transportation. Some of our patients live near a bus route, so they do take the bus to our center, while others may drive their cars to the facility, while others are on Medicaid who qualify for cab service. In inclement weather, particularly in the winter, transportation can be a real issue. Mental health. We find that depression and anxiety issues must be treated, and the condition must be stabilized first before someone can embrace a lifestyle change. It just makes it difficult for them to focus and embrace this lifestyle change. Time, our staff has offered classes such as improving organizational skills to help maximize the participants' time versus accomplishing their health goals. Our goal is to help them free up some time so that the participant can maybe cook more at home or exercise more regularly. The access to fresh foods, the Mercy Comprehensive Care Center has been mentioned as that it is located in a food desert, and many of our participants purchase food at the dollar store because of the limited access to supermarkets. Last summer, the African American Heritage Farmers Market came to our facility on a weekly basis, and we provided each participant with a voucher to purchase fresh produce. We really did receive great feedback from this resource, and we hope to continue that next summer. Change established eating habits. Staff must remember, making a lifestyle change is difficult and requires patience. It takes more than 60 days to see one change, and for some, much longer, depending on the number of the barriers each participant faces. These are just some of the many different nutrition education topics that we talk about. You know, setting SMART goals. We try very hard to make their goals, well, they decide themselves actually, but to make that goal specific, measurable, attainable, relevant, and timely. Helping them tracking in their food journal, portion control, reading the nutrition facts label, cooking demos, taste testing, healthy eating on a budget, sodium and heart-healthy fats, fiber, sugar, recipe modification. And currently we are formulating a healthy cookbook from our staff and participants' favorite recipes, and we're hoping that to be ready for our summer picnic in July. So now we move on to measuring success. The participants' data is collected and charted in eClinicals or our electronic medical records, and we look at height, weight, BMI, and body fat percentage, which is calculated by the Omron handheld monitor. The RD, the dietitian, calculates each participant's estimated daily nutrition needs, such as kilocalories and grams of protein. And prior to each class, vitals are taken, blood pressure, weight, heart rate. If we find, for example, that a blood pressure is significantly elevated, we'll repeat that again at the end of the class. We also track the participants, for example, if they have consistent elevated blood pressure, we'll create a list and fax that over to their primary care provider or their cardiologist. And I think this is a prime example of an integrated approach enhancing the quality of patient care. Then we do a comparison of participants' information from the initial to the last class. Again, comparing weight, BMI, blood pressure, and lipid profile. We also do pre- and post-test surveys, which are collected, which focus on behavioral health measures such as their self-esteem, their cardiovascular disease knowledge, healthy eating habits, exercise, and we do this by using a 5-point Likert scale for comparison. So what have been the lessons learned? I can't stress this enough. Listening skills are important. We need to listen to our participants. And we find that our participants are really engaged in the program. We try to provide bite-sized information, forgive the puns, but really, we limit the time of instruction. For example, one presenter about 20 to 30 minutes with a question and answer, because as time goes on, we find that the participants' attention span tends to wane, so less is more sometimes. Allow time for feedback and engagement through post-surveys. We talked about this at the end of class. Be budget sensitive. And finally, keep it real, simple, and visually engaging. Thank you.
All right, thank you, Anne Marie, and visually engaging it is. Next up is Kathy Braganola, who is our Heart Smart for Life social worker. She's going to tell you a little bit more about how she works with Heart Smart for Life participants on reducing stress, which we know is absolutely key, increasing exercise, and building balance into their lives as well. So next up, Kathy.
Hi, good morning, everyone. I'm the social worker here at the center, and I also am the social worker for the Heart Smart program, which I absolutely love. One of our topics that we really found that we need to focus more on is reducing stress. We all know that everyone has a lot of stress in their life, but for some of our participants, they have multiple stressors in their life, which can really impact their ability to lead a healthy lifestyle. So we, we recognize that excessive stress contributes to many health factors. High blood pressure, definitely being one of them, asthma, ulcers, irritable bowel, much, much more in the way of health conditions that stress can affect. Also behaviors, we find that some of our participants may engage in, like smoking, excessive alcohol use, physical inactivity, and overeating. These can all be contributed by stress, and a lot of our participants may not even realize that, the stress in their lives are contributing to these factors, which is leading to an unhealthy lifestyle. So we really want to focus on tips and tools to help our participants alleviate stress and encourage healthy coping behaviors. Some of the ways that we try to do this is with the following topics that we have presented in class. The top one there is mindfulness and meditation. And when we first decided to present this to class, we thought, we wonder if people are really going to get engaged with this. And we were delighted that we had such positive feedback that our participants wanted more. They wanted more classes on this and actually asked for us to do a guided meditation, which we will be doing next week. So that really was successful. Anne Marie also talks a lot about mindful eating, which you know, we can all benefit from that. I know I'm a really fast eater, so it's good to slow it down. Sleep hygiene was one of the topics that our participants actually asked for, so that was a really great class. Sleeping, you know, definite for good health and stress relief. Yoga is a topic that we have discussed, and we're going to be doing more with that. Again, like I said, many of our participants have multiple life stressors, and we really try to help them in a holistic way, you know, looking at everything, because when our patients come here to Mercy Comprehensive Care, we know that they have financial worries, that they have health concerns. They may be a caregiver to their family member. Just yesterday after class, one of the participants came up to me and she said, you know, my husband went through back surgery and he, you know, really, I'm his primary caregiver. And he says to me, where are you going? And she says, I'm going to my class, HeartSmart. And he says, oh, okay. And she said to me, this is one of the best things I do in my life. She said, this not only teaches me ways to take care of myself, but this is like my self-care time. And I thought to myself, that is great. That is really what we're here for at the program. So we really like to take a holistic approach to our participants' well-being. One of the things that we're focusing on and we're increasing with our program is exercise. A lot of our participants, you know, have started an exercise program or have increased their exercise, and they were asking us for more resources about ways that they can do exercise. And, you know, we all know that exercise is such an important part of a healthy lifestyle that we wanted to, you know, address this with our participants. And one of the ways that we decided to do this is we piloted an exercise program with our participants where we did chair exercises. We did some seated exercises for strengthening, and we also did chair yoga, and we had huge success. Our participants loved it. And we know this helps them boost their mood, release stress, and increases their self-esteem. So we are going to be actually having monthly chair yoga and seated exercise classes based on our participants' request. I will be teaching the chair yoga, which I did go through a certification, and one of our HeartSmart participants, Carol, she is a teacher at the BAC, and she's going to be helping with the exercise programs also. So we're really excited about this new development. Building balance. That's, again, a holistic approach to our wellness program. We, over the summer, had a summer program where we had families come together to learn about a healthy lifestyle, and we had a lot of topics about strengthening families, organizational skills, healthy eating, cooking demonstrations. We've developed vision boards for our class that we actually did as a class participation, and everyone had some magazines and things, and we cut out pictures, and we keep our vision boards displayed in our classroom to, you know, keep everybody motivated. Eating on a healthy budget, that's an important topic because many of our participants do have a budget that they have to stick to, and we want to be mindful of that. So we like to help our participants gain control over their lives so that they have the confidence to continue to make healthy decisions. So our lessons learned, definitely want to meet people where they are. We want to have our participants make their own goals. Somebody's goal could be, I just want to be able to reach my hands over my head, or be able to tie my shoes, or be able to walk around the block. That might be their goal, and we want to respect that and meet them where they are. We want to make exercise fun and accessible. And we want to recognize that our patients, they have a lot to cope with. And if we can make some of their life stressors a little easier or help them be able to cope with them a little better, then they can concentrate on all the other aspects of our program. We want to keep our curriculum flexible. We're always learning new things from our participants. And we really want to encourage feedback and new ideas. I think some of the best ideas we've gotten for our presentations have come from our participants. So we are facilitators, but we want to think of this as all of us are in this together as our HeartSmart group. So that's pretty much what we do here at HeartSmart, and we're very proud of our program, and we love doing it.
All right, thank you, Kathy. Next is D'Youville College Associate Professor and Pharmacist Stephanie Bryan. She's one of our program partners, and she's here to tell us a little bit more about the medication education component of HeartSmart for Life, because we know how critical that is, certainly for all of the people who are coming to us. And she makes it a better pill to swallow for our participants. Don't pardon the pun. Thanks, Stephanie, for being here, and take it away.
All right. Thank you, Kathy, and hello, everyone. As Kathy mentioned, I'm a clinical pharmacist and part of the HeartSmart team here at MCCC. So one of my big roles, of course, as a pharmacist is medication education, and I spend a lot of time talking with our patients about medication adherence. So the reason that we include this is that medication adherence is such a huge problem in society. Studies that have been done on the topic have found that 1 in 5 new prescriptions is never even filled. And of those that are filled, 50% aren't taken as prescribed. Approximately 125,000 deaths per year here in the United States are estimated to be caused by medication non-adherence. So that's why this is such an important issue. The big question then is, why are people non-adherent with their medications? It turns out that most barriers to adherence can be classified into one of 3 categories: not knowing what to do and why, also known as health literacy, the inability to perform skills necessary for adherence or behavioral change, and finally, systems or administrative barriers. In my talks to our group, I focus primarily on the health literacy, explaining to the patients why the medications are important, how they work, how they should take them, what to do if they encounter problems, although we do often touch on the other 2 barriers as well. Of course, knowing that the patients tend to be non-adherent and even knowing why isn't enough. We also need to incorporate some strategies to try and improve adherence. So far, studies that have been done on this topic suggest that accessibility to providers across the continuum of care, use of a team-based approach to care, and educating and empowering the patients to understand the treatment regimen and its benefits are all helpful in improving adherence. So as you guys have heard and understand, our program definitely utilizes a team-based approach. We have healthcare professionals from multiple disciplines who come in and do a wide range of topics with our patients, and they respond very well to it. I've found in my sessions, and as some of the others have mentioned, that it's not only hearing from us as different healthcare providers that seems to help them, but also listening to each other. And as an example, when I talk about the medications, it sometimes can be as simple as one patient asks a question about a medication or a side effect that somebody else was either too shy or nervous to ask about, or maybe they meant to ask but they just forgot. So the patients oftentimes bounce ideas off of each other as well, so it almost functions secondarily as a support group, which I think is really nice and beneficial. As far as the challenges are concerned, you know, we do occasionally face some as a program, as a group. For me, the biggest ones are the ones that you see listed on the slide. So not every patient in the group has every single disease that we discuss, and of course, because of that, they're all on different medication regimens. Consequently, it can be tough sometimes to keep most or all of our participants engaged when not all of the information is directly applicable to them. So what I try to do is I try to keep the information basic enough so that those with the poorest health literacy can keep up, but still add in enough higher level information so that the patients who are a little bit more advanced are also still interested. Also, with respect to the time constraints, as again, some of my teammates here have mentioned, it can be tough to cover a very broad topic in a relatively short amount of time, which we have to do in order to meet everybody's attention span. So for myself, when I'm trying to cover something like blood pressure medications, obviously I can't talk about all of them in the space of half an hour or an hour. So I'll try to focus on the most important general information. And again, that goes back to why taking the medication every day as prescribed is important and what some of the common side effects are among all blood pressure medications, rather than going into detail about every single drug that's available for treatment of blood pressure. So how can you succeed in implementing or participating in such a program as a pharmacist? My recommendations are first, plan, and plan some more. Definitely be prepared to speak longer than you expect. These guys are kind of laughing at me, I think, because every single time I go over, and I really don't mean to. Generally, I'll practice my presentations, and I know that if I'm allotted an hour, I'll try to make sure that when I practice it, it's no more than 30 minutes, because I know that our participants are going to ask a ton of questions. Now, that's something that if you're establishing your own program, you're going to have to get to know your audience and find out. I feel very fortunate that our group is so engaged and involved, and I love it that they ask questions. It's just that it is an extra step in preparation for me to know and kind of be able to anticipate what questions they'll ask and how to keep my presentation content short enough to allow them time to ask questions. The other thing that I try to do is if somebody's asking a lot of questions that are more pertinent to their own personal situation, I'll ask them if they have time to stay afterwards so that I can speak with them one-on-one so that we don't get derailed too much and off topic to the point where the rest of the participants are sort of checked out. We want to keep everybody involved as much as possible. So the reason that there's a scale on this slide is it's all about balance. Keep the information as general as possible while still being informative, and make sure you're trying to avoid things like medical jargon and items that your patients either aren't going to understand or just may not benefit from. Thank you very much.
All right, thank you, Stephanie. Well, joining us now is Nancy Stoll. She's Mercy Hospital's Director of Neuroscience Clinical Services. And she's going to talk a little bit more this morning about our program partners as well, because she is a program partner through our stroke care and stroke patients. And she's going to tell us more about the keys to creating impact and sustainability with your program. Nancy?
Thank you, Kathy. I'm so happy to be here, and I was so happy to learn about the HeartSmart program. Having a good deal of experience in primary care, and especially in underserved centers, I understand the issues that many of these patients face in terms of health maintenance and wellness. When I learned about the program, HeartSmart for Life, brain health and brain smart really is a perfect partner. So I asked Jeannie if I could join the group. I'm going to talk a little bit about being a partner and the keys to impact and sustainability. We're going to talk about collaboration to meet the needs of a diverse population, supporting the continuum of care, engaging participants, and promoting and reinforcing a culture of prevention and wellness. Okay, so collaborate, collaborate, collaborate. I find, and I think my partners here will all agree, that we need as many cooks as possible to reach our population. Our partnerships provide streamlined care and access. Sitting with a manager, a social worker, a dietitian, a pharmacist, we are able to address so many issues and have a very special approach that is valuable to the patient. Obviously, there's common risk factors, but there's also barriers to health for many of these patients and families that you have heard that we can address and provide outreach for. We're pooling our resources, and we're creating a very integrated approach. And, you know, just to follow up on that, the patients really like that. The participants, I say patients because I see them in the hospital, here at MCCC, you know, they're back in the community. And when we talk about supporting a care continuum, that's exactly what our role is to provide prevention and health teaching so the patient returns to the community and is able to be in the best possible position to live a healthy life. Promoting healthy living, stress reduction, all the things that we spoke about is provided to this group. But I think it's also important to talk about evidence-based guidelines. We know that in heart health and in stroke health, heart
evidence-based guidelines are guiding force for education. So sharing, blood pressure guidelines, heart rate guidelines, all the things that we need to get across to our patients so that cardiovascularly and neurologically they're able to address these needs is a big part of what happens during these meetings. I was amazed, stroke signs and symptoms, going through them with the participants. Some of them really had no idea. They understood a heart attack, but not a brain attack. They didn't understand how important it is to get to the hospital so that we could initiate TPA if appropriate. We talked a lot about endovascular procedures. And, one of the most important things is reinforcing that relationship with the primary care provider, because really that's where it all happens. But our primary care providers are burdened with so much to cover in such a short time. So having a program like this builds on what they're doing and supports them as well. Our approach is multi-layer. As you heard from my partners, we're gathering feedback that helps us guide selections. We're allowing participants to share successes. I was a little nervous my first presentation, thinking that there wouldn't be any questions and it would be quiet. Was I in for a surprise? I, too, went over. There were so many questions, and I'm happy to say, you know what? We really made a difference that day. One woman comes to my mind. She had very high blood pressure, and we talked about sleep apnea. And she shared that her physician has asked her to use a CPAP machine, and she would not do this. And when we talked about it, what it came down to is she really didn't realize how it affected her blood pressure. So, Kathy, our social worker, got right on the phone with her primary. We were able to get a script and facilitate her getting that CPAP machine. Another situation that comes to mind is one session where all of our participants, their blood pressure was somewhat elevated. It was right after the holidays. I'm sure, everyone was, a little free with extras during that time, and we spent a whole hour talking about blood pressure and what it can do. Do you know, our next meeting after that, every single participant had a reduction in blood pressure. So again, these, I'm just talking to you about very simple interventions, but really strategies that help. Lessons learned, again, reiterating and recapping the high points. This is what you have to spend a lot of time reiterating, sharing modification tips, and they need to understand that these are lifelong changes. I feel that taking what patients ask for and coming back. For an example, memory issues was a topic that came up. We're going to have someone from Brain Coalition coming in to speak. So this just continues to grow. I thank you for the opportunity.
All right, thank you, Nancy. If I could ask everyone just to take 40 seconds and pause for a moment of silence, just for 40 seconds. Thank you. Someone in our country just had a heart attack. According to the American Heart Association and the Center for Disease Control and Information, someone in the United States just had a heart attack, and someone has a heart attack every 40 seconds. Each minute, more than one person in the United States dies from heart disease, heart attack, heart failure. We know that not only in our community, but across our country, this is a critical issue. And that's why we're so privileged to share with you today some of our lessons learned from our program at HeartSmart for Life. So just to recap the overall lessons that we've learned in our program, meeting people where they are is essential. You have to break outside of your own walls, and you also have to not only physically meet them where they are, but emotionally and mentally meet them where they are in their care. Your program should create an environment of community and emphasize a judgment-free and safe zone for everyone. It's critical to engage strong program partners to create cross-program integration and sustainability. Offer incentives, engage, and it creates a corporate compliance atmosphere and participation as well. Empower participants to create their own SMART goals. It creates buy-in and ownership of the program. And finally, celebrate success. Small successes add up and help participants stay focused and positive. And I want to thank you again for joining us and thank all of our presenters today. I'm going to turn it back over to our friends at Population Health Collaborative for comments and questions in these final few moments.
Okay, thank you all very, very much for that wonderful presentation. We do have a few questions that have come in. The first question is from Maria, and she would like to know what are the tools that you use to measure the self-esteem and stress levels. Now, Anne-Marie, you did cover this a little bit about the pre and post surveys, but I was wondering if there's anything else that you had to add.
Well, I mean, we are very direct with the question. Has this program changed your self-esteem in any way? Yes or no? That's what I mean, that is direct as we got it, you know. It was direct feedback. We speak to people in our classes, and you can see the gradual changes as the months progress. It's a you know, and it's also measured by body language. They exude more confidence with each passing session.
And we also do the pre and post-test survey that actually asks the question at the beginning and at the end about their level of stress, and we use a Likert scale to track that, to make that measurable.
Okay, thank you. We do have another question from John. Has anyone studied how much this program costs per person and how much it generates in healthcare cost savings?
Well, one of the things we have been measuring and are starting to measure a little bit more comprehensively, I will say, is repeat visits to the hospital and connecting people to primary care. I can't say that we've crunched the numbers on an individual basis. However, we do know that it is reducing those frequent visits to emergency departments, because that, again, is another self-reporting measurement that we're gathering through the program. So it's definitely something that we are measuring in our program of how we can reduce the cost to health care, and certainly we're asking our participants to get connected to primary care.
Okay, thank you. Does anybody else have any other questions? You can take another minute to type it into the chat box. There is a question if the slides will be made available. The answer to that is yes. They will be posted after the holiday, so please be on the lookout for that. And you also will be receiving an evaluation, so we at Population Health Collaborative would really appreciate it if you would complete the evaluation form. If you would like to get in contact with any of our friends from the HeartSmart for Life program, that information is available on the Mercy Comprehensive Care website, which was sent to you all. The link to that website sent to everyone. And I don't see any more questions coming in. So on that note, I would again like to thank the team very, very much for participating or for presenting today, and for everyone attending today. Thank you all very much. Have a wonderful rest of your week, a wonderful weekend, and we will be in touch soon with you all. Thank you.
Thank you.
Thank you.